There is an age that we will get, we will now have not to train the child, but try to break the habit that has already been developed. So I would rather we start from this tiny little brain that is not yet, has not like formed a character, formed an habit. It is easy to train now them, this is what we are supposed to do, this is what we do when we feel this, when you experience this, is that's how you calm yourself and everything. It is easier training an activity, a habit or an activity, rather than having now to break this habit and retraining again the habit. One of the things that I've realized parents do is they will be with their children, and then their buddies come and they'll start now pouring out their frustrations or whatever they feel. It's good to speak yourself out, but make sure when you're speaking yourself and everything, you're expressing yourself to your friend, make sure your child is not there with you, because these children listen, they hear, and they do understand. The only challenge they have is they cannot express and talk back and tell you, by the way, mommy, you said 1, 2, 3. By the way, dad, I heard you say 1, 2, 3. So please be careful what you say near these children. Take your time. Do not say negative things near them, because it affects them and they will not come back and tell you, this is what I feel, this is what you said, and I felt bad. My name is Doreen Kagendo Gitonga. I am an occupational therapist, having practiced for over 10 years now. I'm sure you're wondering what occupational therapy is. If you look at the words occupational therapy, we have occupation and we have therapy. Occupation basically means what you do every day. Like in a layman's language, ni job. Now, job, we do it every day. You wake up, go to work. But apart from the work, there are other activities that we do from waking up to sleeping. And even that waking up is a job too. Sleeping still is something that you do. It's not something that comes automatically, especially for people that have challenges. So an occupational therapist or occupational therapy is a branch of science and art, or rather it's a mixture of art and science that looks at a person as a whole. How do you operate as a human being, whether at work, whether at home, whether you're sleeping, during leisure activities, and everything. So as an occupational therapist, I'll be concerned about your functionality. You've gone to sleep. Was your sleep okay throughout the night? If no, what were the challenges during your sleep? You've woken up in the morning. The first thing you do when you wake up in the morning, probably go brush your teeth. Can you brush your teeth properly? Can you wash your face without any challenge? Or if you have any challenge, let's say you have a physical disability, how can we help you wash your face without, or rather with very minimal challenges, and you do it by yourself? So in conclusion, I'll say occupational therapy is about independence in every single activity that we do in daily life. Like I said, you wake up in the morning, all the activities you do, taking a shower, going to work, if it's a child, going to school, or going out to play, everything that involves from the cycle of waking up and sleeping at night.
Who benefits from occupational therapy?
Basically, I'll say actually not only the people with disabilities, because like I said, we are concerned about how you as a person function, whether you have a disability or not. Now, to prove my point, it's not only people with disability. We wake up every day and we go to the office. Yes, you don't have any physical disability, you don't have any mental challenges, you don't have any, nothing, no challenge that you can see, but you go to work every day, sit down. For people who are working in an office, you're sitting down, typing in a laptop every day, doing stuff. At the end of the day, people end up with a lot of pain, either back pains, the neck problems, and other challenges. An occupational therapist comes in where they're supposed to come to your office or where you work, You're complaining of the back, yes. We've seen the origin is your work because you sit for so long. An occupational therapist is to come and assess where you are. How does your seat look like? How is your sitting posture at work? Where is your table located? Like, do you sit bending down or do you sit up and to the right level that is recommended? Because as much as we do these furnitures, the office furnitures, they are the recommended sitting postures for you to avoid a lot of occupational, or rather the problems that results from our workplaces. So yes, someone with disability or someone without disability, we can all benefit from occupational therapy.
Okay. And what's the importance?
The importance of occupational therapy, summed it up all.
Mm-hmm.
Everyone functions every day.
Yes.
Like you do something when you wake up. You don't just sleep and like we said, even that sleep, when you go to sleep, are you getting the sleep? So I won't even say it's an advantage. Occupational therapy should be part of life. Yeah.
So if we tie back to Geuza Wazo, because we are mostly about people who have developmental disability, what are the kind of disability that you have found yourself engaging in? Like,
when you talk of developmental disability, we're talking about mostly children. And with children, we have seen Down syndrome, autism, children with delayed developmental milestones, children with autism, children with even other syndromes that are not very common, like I've seen a child with Rett syndrome, and basically any other challenge that comes with growing up.
for occupational therapy to be effective, what would you recommend?
Like I said, occupational therapy involves both adults and children. But on this part, because we are talking about Geuza Wazo and Geuza Wazo is about children, let me focus more on children. What I'll say is, for children at any age, occupational therapy will work, but it is very, very necessary for parents with children with challenges to start as early as possible. We need to start therapy as soon as you realize there is need, because the earlier the better. And then this child's brain is developing. At this point, when we're doing therapy, most of the time we target training the brain to acquire skills and activities that are not fully developed. So it's better to start early as the child is developing, so that they will get whatever you're training them. It is easier that way. The longer you stay, maybe let's say, for example, give an example, a child with autism challenges, they will get to a point and the brain gets to learn whatever they do is normal and it's part of their being. So there is an age that we will now have not to train the child, but try to break the habit that has already been developed. So I would rather we start from this tiny little brain that is not yet, has not like formed a character, formed an habit. It is easy to train now them. This is what we are supposed to do. This is what we do when we feel this. When you experience this, that's how you calm yourself and everything. It is easier training an activity, a habit or an activity, rather than having now to break this habit and retraining again the habit.
So in your line of work,
Let me add something. Apart from now the challenge that comes with mental problems, there is the physical disabilities too. Let's say, for example, children with cerebral palsy or children with delayed milestones. These people will need intervention as early as possible, because again, the child is developing, the bones are calcifying. The more we continue growing, the more stronger the bones are becoming, the more stronger the muscles are becoming. So if we have a child with CP who is a bit spastic, like how do I put it? The muscle tone is high, and you stay for long without therapy, this child ends up developing contractures, and breaking these contractures is a bit hard. So it is important, once you get that diagnosis, start therapy immediately. Yeah.
Some people might think therapy is a waste of time, therapy doesn't work, and all other things that you've been told. Some of you even go to an extent, you've gotten maybe the diagnosis and the doctor has advised you to go for therapy, and then someone just from somewhere comes and discourages you from that. From a professional point of view and from my experience, therapy does work and it really helps a lot. And I'll give you two examples. One, a child with developmental delayed milestones, and another one, an autistic child, to show you, regardless of the disability, it's doable. Now, this particular child that now you're talking about, the with delayed developmental milestones, had like struggled for quite some time. They never knew what the problem was until they came to my place, and we started therapy to help the child gain independence in walking and doing other things. The child at that point could not even stand, and within 2 months, the child made their first step, and it was emotional. The mom cried because it's like they had despaired, and the information they had got, they had lost hope with their child. They knew this is it. Their child will be confined either in a wheelchair when they grow up or something. But we did it, and the child right now is very much okay. For the case of autism, I received a child who had autism diagnosis, yes, but this child, they only wished to stay like lying down. They couldn't talk, they could do anything. They just want to lie down. Even if it's eating, it's lying down. I know some of you, autism as hyper, but there's another side of autism. There is hyper and there is hypo. Hypo means they are not as active as the hyper children. And this now comes with the sensory challenges that they are having, how they are interpreting the sensory input that they are getting from the environment. Some of them will be on the higher side, others will be on the lower side. So this particular child was on the lower side of sensory interpretation in their brain. So all they wished was to just lie down and that's it. And they can't talk, they can't do anything. I went did my assessment. We started therapy sessions. We worked together with the mom. That is something that is very, very necessary. You cannot decide to rely on the therapist alone, not because therapist alone can't do it, but it will prolong the period that you're supposed to see results, the period that you're supposed to progress. You're supposed to work hand in hand with the therapist. If the therapist comes and tells you we've worked on this and this, and please, as you're left at home, work with 1, 2, 3 things, make sure you do that. So we worked with this particular child, and again, in 3 months' time, the child now, I'll call it dormancy, not dormancy, that's not the best word. Now that love for lying down and they don't want to do anything, they're not interested in anything, it changed. The child became a very happy and active child. He started talking, and actually we discovered this child could read and he had not even joined school. So as you can see, therapy works. But there is something that I would like to advise parents. Like I mentioned earlier, you need to work hand in hand with the therapist. By this, I mean a therapist will come and see this child, whether you're taking the child to the hospital, the therapist will come visit you at home and everything. They'll come to your place or you go to their place from 1 hour, maximum 1 hour, 30 minutes. In a day, we have 24 hours. So those are around 23 or 22 and a half hours you're with this child. If you don't do anything, you take longer time in achieving. So whatever the therapist says, please follow it. Whatever the program they give you to follow at home, please make sure you do. It makes things very easy, and you see changes by the time we are getting the 4th to the 6th week, you should have seen a considerable amount of change. There's something I would love to speak about, especially for parents with special needs children. Um, one thing is this child, as much as they have challenges and everything, this child is just like any other child that you have. Please handle them, treat them just like the way you treat the other children. Handle them the way you handle other children. Speak to them the way you speak to your other children. Because again, this child is growing up, they're going to interact with people, and the world out there is not in a position, or rather they are not under obligation maybe to now give your child a soft landing. Let me call it a soft landing or something. Train this child to grow the same way you train other children. Do not give them special treatment. Now, by special treatment, I mean they might do something that you feel this one is out of order. Please call them to order. Just like you're calling to order the other child that you have. Do not let them have in their mind that I can get away with 1, 2, 3 things because I have some challenges that everyone around me knows. Because then again, they are going to use that in the society in future. Look at this child when they are 17 years, 20 years, 25 years, 30 years. This child won't be 5 forever. This child will be 30 years, and at some point they might go out and meet the world. So train this child how to interact with the world. Even when he grows up, he'll still continue with whatever you taught them. Another thing I'll talk about communication. Like I said, talk to them the way you talk to the rest. Do stuff when you're going somewhere. Please inform your children, all of them, whether the child is special or not. Tell them we are going here. This is what we are going to do, and everything. Do not assume because the child cannot talk back to you, or rather they cannot answer you. It doesn't mean that they don't understand what is happening around them. They don't hear, unless it has been confirmed to you that this child is completely deaf. Do not assume they can't hear and they cannot understand. And what happens is, and one of the things that I've realized parents do is they will be with their children, and then their buddies come and they'll start now pouring out their frustrations or whatever they feel. It's good to speak yourself out, but make sure when you're speaking yourself and everything, you're expressing yourself to your friend, make sure your child is not there with you, because these children listen, they hear, and they do understand. The only challenge they have is they cannot express and talk back and tell you, by the way, mommy, you said 1, 2, 3. By the way, dad, I heard you say 1, 2, 3. So please be careful what you say near these children. Take your time. Do not say negative things near them, because it affects them and they will not come back and tell you, this is what I feel, this is what you said, and I felt bad. But this thing will remain in them. Mommy said I'm a disappointment, or rather, mommy said I will never walk, or mommy was saying that I make her feel stressed. It's not good. It's not a good input for the child. Please make sure whatever you discuss, the child is away. If you're deciding to, or you're planning to do something as a family, let's say you're going for an outing, you're taking other children and even this child along, let them know. When you go to work, let them know in the morning you're going to work and you're coming back this time. Like, let them be aware of whatever is happening around them. It really helps a lot, even reducing the tantrums and everything, because they understand what is happening. If a tantrum comes, let it come because of the sensory overload and everything, but it's not because they are frustrated and they cannot communicate to you because they don't know what is happening around them at that particular time. Yeah.
Okay, so some of you might be wondering, how did you become an occupational therapist?
I applied in KMTC for occupational therapy, and I was invited. And I think those days getting a KMTC was a very big deal. But we were doing, and I can say that's the best thing that ever happened to me. Probably I wasn't even aware what occupational therapist is as much as I had applied, or rather I didn't have like a deep understanding of what it involves. I only knew we work with disabled people and that's all, or we work with children with special needs and that's it. I didn't know anything beyond that. But being in the profession and seeing whatever is happening, seeing that, allow me to call it a magic of being able to make a child that has not been walking make one step, being able to make a child who was not sitting down, make them sit down and do their coloring, make a child who was not communicating start talking to you. And kindly note, we are not speech therapists. They are speech therapists, yes, but we are not. But from the therapy that we normally do, when the sensory levels come to an optimal level, the child definitely, it's like the house is organized. They are in the inner being is somehow organized, and then now they can start expressing themselves slowly by slowly. And there now we engage now speech therapists. That's why we say if you have a child who is hyper, you cannot jump to speech therapy immediately, because for a speech therapy to happen, therapists need to sit with the child. So if the child cannot sit, nothing will happen. So you need to have like an OT work with the child, bring them to calm down, bring them to sit down and do 1, 2, or 3 activities. Then now you can involve the speech therapist to help in communication further. So seeing those things that were not easy happening, making their life easier and all that, it's such a reward that no one can really value that in terms of money. How one feels when you see that positive change, when that parent tells you, by the way, my son did this today or my daughter did this today, it's something that is out of this world. So yeah, I can say it's a very good course to do. And you will do it in Kenya Medical Training College for a diploma, and there are degree programs that are happening in the country. I understand JKUAT to have a program, a BSc in occupational therapy. I'll speak about KMTC because that's where I was. You need the sciences. If you don't have physics, is okay. Mathematics is necessary. It's not a must, but it's very necessary. So at least if you have a C in mathematics, you're safe. Yeah, and you check for the adverts. They normally have intakes in September and March every year.
And how long does it course take?
Diploma in occupational therapy is 3 years. Uh, uh, I think, yeah, it's 3 years.
Yeah. For a parent who has just got their diagnosis, what would you tell them?
As a professional, as an occupational therapist, this is what I'm telling your parent who has received the diagnosis, or rather, you've been told your child has got challenges. What I'll say is, it's not the end of the world. And another thing, you're not alone. There are so many people walking this journey. So the best thing that you can do as a parent and for your child is, first of all, accepting the challenges there. Whether you've got the Down syndrome diagnosis, whether you've got the autism diagnosis, you've got cerebral palsy diagnosis, whatever form of diagnosis that you've received, please know it's not the end of the world. And from professional point of view, you are not alone, and it's doable. It's possible. This child can live their life just like any other child. All you need is start as early as now. I know the diagnosis comes with a little bit of mixed feelings, with a lot of disappointment, despair, frustrations, and everything. Allow yourself to go through those emotions because it's very important for you. But as you go through those emotions, please make sure you will get to a point whereby you get out of now your frustrations and everything and step up for your child. Because again, at the end of the day, this child depends on you, and it is you that is going to stand up for them. It is you who is going to seek help on their behalf. Because for themselves, yes, they have the challenges. They cannot go out there looking for therapists. They cannot go out there looking for stuff. It is you. So please get out of whatever you're going through, engage with other people. There are social media groups that you can join that have people with similar challenges. Join, get to know how they deal with it, get to know how they just interact with people the much you can. And then now please engage as a professional. as early as you can. It will be very necessary and very useful for your child. And once you engage the professional that you engage, make sure you always know what is happening to your child, what the therapist is doing with your child, what are their goals, what are the objectives. After a period of time, sit down, see what have we achieved, what do we want to achieve, and where are we headed? Because again, in this journey, as I said, you are the one to stand in for your child. You have to make sure the child gets what they're supposed to get.
Okay. And for anybody who is watching this video and has settled as Doreen for an occupational therapist, where can they find you?
Follow me on a social media page occupation called Gitonga Doreen. That is on Facebook. You'll find me there. Once you reach out via Facebook, we'll discuss further and then I'll give you my contacts.
So Gitonga Doreen, it's D for DOREEN.
Yeah.
Okay. So I think that's all for now. Thank you for accepting the interview request. So I'm hoping that in another episode and in another we can now go to the specifics of having, say, occupational therapy and autism, OT and cerebral palsy, because I believe that each therapy and each condition, like they can't all be the same.
Definitely.
So I hope in the coming weeks we can have another sitting where we can discuss another disability. Yeah, and for the people, you want to say something?
I'm just saying thank you to Geuza Wazo for giving me this opportunity. I'll be glad to share more information that I have. I'll be glad to try and help the parents as much as I can. It's my joy. When you make that one simple step, that makes me feel good. Yeah.
Okay, so anyone who's watching this, thank you for, if you have any questions, any comments, share in the comment section. And until then,